Did you know that the fastest movement your body can make is eye movement? Like eyes are moving faster than any other parts in the human body, and that is through something called saccades or saccadic movement. And what if I tell you that your brain predicts what you see next, and that is through a smooth pursuit? And these are some of the things that we're going to discuss today. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to discuss about the ocular motility, which is translated into eye movement. And we have a curious question to ask ourselves, like, why do we need to move our eyes? Yeah, we covered this question when we were discussing the photoreceptor layer of the retina. We said this is what we call look. So looking is directing your eyes, purposely directing your eyes to an object of interest. And we said, why do we need to look? Is because we want the light rays from an object of interest to fall to the retina, to the central part of the retina, which is called the fovea centralis, where we have high population of cones. Remember, we said cones are the photoreceptor cells that have good quality of image. So when you're looking at something, you are directing the light rays from that object to fall directly to the fovea centralis, because they will have a lot of cones, and cones will give you quality of image. So you will see that image by its quality. For example, when I am looking at this, it means I am directing my the light rays from this watch to fall directly to my fovea centralis, because that is where I have a lot of cones, and cones are known for best quality. So I'm looking at this one, means I want to get the best quality of image from this watch. But for me to be able to look at something, I will need to move my eyes, and here's where the ocular motility or eye movement come into play. Okay, so we move our eyes to keep an object of interest, tracked at the retina, at the fovea centralis. Okay, and the ocular system, finds, focuses, fixates, and follow the object to ensure optimal vision as we move through our environment. So when you are moving through your environment, your eyes are constantly, moving, fixating, focusing. Yeah, this is what they are doing, like constantly. They are not resting. This is why I'm telling you that the eye movement is the fastest movement that your body can make, because whenever you're moving, they are like constantly moving, try to fixate, so as you get the best quality of your surrounding. And that, of course, is another way that you are meant to survive in a kingdom and Maya, because remember, we're meant to be in jungles, like to live with dangerous animals like lions, snakes, and some other dangerous animals. So your eyes need to be sharp so as to detect dangers beforehand. Like even when a leaf is falling on this side, then your eyes are moving very fast, and you are constantly move, fixate, and focus in different directions, so as you get the basic quality of image for you to be able to be prepared of the dangers that might arise when you are in that jungle on dangerous situation. And another thing which is extremely important in this discussion is the axis of rotation of the eye. Like we need to know the the basic axis through which the eye can rotate. Number one, we have the vertical axis. A vertical axis is going like this, yeah. So it's going through the eye, yeah, like this. And then through the vertical axis, your eye can either rotate medially or laterally. So laterally or medially. And then we'll have, so when the eye is rotating medially through the vertical axis, it is called the medial rotation, or adduction or medial rotation. And then when the eye is rotating laterally through the vertical plane, it is called abduction. Next, you have the horizontal plane. This is the horizontal plane, and the horizontal plane is going like this. And through the horizontal plane, your eye can either, go above the plane or below the plane. So when it goes above the plane, it's called elevation, or supraduction. We're going to discuss it later, no worries. And when it goes below the plane, it's called, depression. So your eye can either depress or elevate along the horizontal plane. And the last plane is called anterior posterior plane. So anterior posterior plane is passing through the center of the eye, and then it's going from anterior to posterior. And from the anterior posterior plane, the eye can either rotate. You see, this is the rotation movement. So the eye can either rotate laterally or rotate medially. So when it rotate laterally, it is called extorsion or exocycroduction. We're going to discuss it, of course. And when it rotates medially, like turning medially, it is called incycroduction, also known as intorsion. You know, guys, the eye is globular in shape, like it is spherical in shape, and because it's spherical, the movement that it makes is a rotational movement. Yeah, and you guys know, for you to have a rotational movement, you need to have axis of rotation. You discussed the physics, rotational dynamics, rotational movement. Okay, so we have different classifications of ocular motility, but for context, we're going to discuss two types of eye movement. Number one is duction, and number two is binocular movement. The duction is the unocular movement, like that means you are tracing the movement of only one eye. Yeah, so one eye movement is called duction, but binocular movement is the movement of both eyes. So here are some of the ductions, which means unocular movement of one eye, and then the movement of one eye, we have only six types, and we have already discussed them already. So we have adduction, that is medial rotation, yeah, through the vertical axis. We have abduction, which is the lateral rotation through the vertical axis. We already discussed it. We have the supraduction, which is called elevation, when it moves above the horizontal plane. And then we have infraduction, which is downside movement, yeah, and infraduction or depression. And then I've told you now about the intorsion and incycroduction. I think here is where I need to spend a little amount of time to explain about it. You probably never heard of this one. So you assume the globe to be like this one. This is a globe, yeah? And then at the globe, we have the 12 o'clock position, this position here, 12 o'clock position. So when the globe, the 12 o'clock position moves medially, when when the eye rotates in the anterior posterior plane and the 12 o'clock position moves medially, it is called intorsion. Now assume I have a 12 o'clock position here. Let me use this one. So assume I have a 12 o'clock position somewhere here, and when this is medial, this is lateral. So when this 12 o'clock position move medially this way, this is called incycroduction or intorsion. And then when this 12 o'clock position moves laterally, so this eye is rotating in such a way that the 12 o'clock position goes laterally, that is excycroduction, also known as extorsion. And the other way is intorsion. I think it makes a lot of sense. And that movement is the anterior posterior, through the anterior posterior axis. Okay, yeah. So the superior pole of the cornea, which is now you can 12 o'clock position, I think will do. Okay, so that is the ductions. Ductions are movement of only one eye, the movements that are involving only one eye. And then we have binocular movements that are involving both eyes. Yeah, these are binocular movements. Remember, we just discussed the unocular movements, which are ductions. Ductions, unocular movement of one eye. But binocular movements are movements of the both eyes. And now, movement of both eyes can either be to the same direction or to the opposite direction, like when you are turning your eyes to face each other, so they are moving in the opposite direction. Movement of eyes in the same directions, it is called vergence. So vergence are the ocular motility to the same movement of both eyes to the same side. And then when the eyes are moving to the opposite direction, it is called vergence. So it depends on where they are looking. So we're starting with the vergence. When both eyes are looking to the right side, it is called dextroversion. Yeah, dextro is the Latin word for right side, right. Yeah, levo, remember, if someone has got someone who the apex of the heart is on the right side, is called dextrocardia, because the dextro is right and cardia is heart. So like the heart is on the right side. So the same applies here. This is just a Latin translation. So dextroversion means the eyes are moving to the right side, but both eyes, because the vergence movement is the movement in the same direction. So both eyes are moving to the right. That is dextroversion. Levoversion, left. Supraversion, up. Infraversion, down. But we can also have combined, like this is called the upper the extroversion. Like you see, it is to the right side but above. So upper the extroversion, upper level version, lower the extroversion, lower level version. But there's something also very important to notice, that when your eyes are looking straight forward, like when you are naturally looking forward, that is called the primary gaze. The primary gaze is when your eyes are looking directly forward, like that is the primary positions of the eye. And we're going to discuss later in the later discussion that all the muscles of the eye that are supporting the movement of the eye, they're acting together to keep your eyes like in a primary gaze, yeah, to keep your eyes in primary gaze. You will see we have different muscles that are doing this level version and whatever, but you cannot understand them at this moment, but you have to come back when we discuss the extraocular muscles, which is the next discussion. Yeah, so you will always be back to this picture. So remember, this was vergence, means the movement of eyes into the same direction. Now let's see the movements of eyes into the opposite direction. So the movement of eyes in the opposite direction is called vergences, or also known as disconjugate. Oh wow, at this I didn't mention about the vergence. The vergence are also known as conjugate movement. Wow, I didn't say. Yeah, here they are also known as conjugate or simultaneous symmetric movement. Vergences are the synchronous and symmetric movements of both eyes, but in opposite directions. And in the opposite direction, it can be towards one another or away from one another. When the eyes are moving towards one another, it is called convergence. Convergence, like, you know, when you are turning your eyes to face each other. Like, I know you guys have different abilities of turning the eyes into, you know, face one another. That is called convergence. And when the eyes are moving from, you know, away from one another, it's called divergence. And it should be easy into your context that you can try at this moment, that it is easy for you to converge your eyes. Yeah, like the degree of convergence is higher than the degree of divergence. Like you have limited degrees of diverging your eyes. Like I think this is my maximum. I cannot go further. But when I tell you to converge, you can go as much as, you know, almost the eyes are facing each other. That is to tell you that the degree of convergence is higher than the degree of divergence. And I know you guys assume divergence in horizontal plane, and this is what we see commonly, like this eye is going this direction and this one is going this direction. But we also have vertical divergence, you know, in which one eye is facing a little bit lower and the other one is facing a little bit higher. But also the degree of horizontal divergence is higher than the degree of vertical divergence. Yeah, maybe you don't have to go through much of this you know, divergence stuff, but that is the divergence. Perhaps you're asking yourself, why are we talking about convergence and divergence? Is it really applicable in our daily lives? Yes, it is applicable. Of course, it's a little bit of physiology, but it is also very important in neuroanatomy and the neuroscience in general. Convergence is coming into play when you are looking at something which is close to you. When you want to look at something which is close to you, the eyes will converge, and when you want to look at something which is a little bit away from you, your eyes will diverge. Now I want you to practice this with your friend. Now I want you to demonstrate this with your friend. So hold a pen in front of him and then tell him to concentrate into something, to look at something which is 100 meters away from you guys. Yeah, not to look at this pen. And then observe the eyes of this guy and tell him suddenly to look at the pen. You will see the eyes are moving. So if I am looking away, you see my eyes are diverging and converging, diverging and converging, diverging, converging. So I assume when you demonstrate it to your friend, you will be able to see closely. Perhaps you don't see mine properly, but when you do it to your friend which is close to you, you will see, you will get this sense of convergence and divergence. Of course, we're going to talk about something which is called accommodation triad. Of course, not in this discussion. It's a little bit of physiology, of course, but you'll be fine. Okay, so these are the binocular movement. Now let's see another example of convergence and divergence. Now I want you to concentrate to the eyes of this girl here. This object is moving closer to her, so you should expect the the eyes to converge. Let's confirm if the eyes are converging as the object is approaching her. Look at the eyes. Look at the eyes. They are converging. And then as you see, as the object is moving away from her, the eyes are diverging. One more time. The eyes are converging. Yes, they are converging. And when the object is moving away from one another, they are diverging. Yeah, let's now see other classifications of eye movements. And this is a little bit of physiology, so I'm going to explain only by using examples, and I'm 100% sure that you will follow, you will understand what these movements are. Number one is called saccadic movement, also known as saccades or saccades. These are the sudden, jerk-like movement of the eyes, and these are the ones that we said these are the fastest movement that your body can make, and it's through the eyes. And how this movement, like this saccadic movement or saccades, is when the eyes are moving at a very high speed to capture an object of interest. For example, I was maybe looking at my PC and then someone calls me somewhere here. So when I'm turning my eyes, like immediately capture the person or the object of interest, that is what is called saccades. So that sharp movement that the eyes are making to capture and so also when you, for example, you listen you hear a very loud sound, maybe you are here and then someone dropped something, that movement that the eyes can make is called saccades or saccadic movement. So these are sudden, jerk, conjugate. Conjugate means they're moving in the same direction that occur as the gaze shift from one object into another. I am giving you another example. Of course, let me use this example. It's covering both parts, the smooth pursuit movement and saccadic movement. Okay guys, I want to summarize saccadic movement and smooth pursuit by reading the first two lines, and I want you guys to read with me. Let's read together, okay? So saccadic movement, saccades are sudden, jerk, conjugate eye movement that occurs the gaze shift from one object to another. Thus, they are performed to bring the image of an object quickly on the fovea. And while we were reading, there are two important observations that you haven't thought about. There were two important things that were happening that you didn't think about. Of course, even me, I wouldn't think about if I didn't know. Number one, while you were reading along the line, your eyes were keeping on tracking, like they were moving very smoothly. You can feel it when your friend is reading around and then you are looking at the eyes. You will see like the eyes are following smoothly. It's a smooth movement. That smooth movement is what is known as a smooth pursuit. Also, for example, when the car is moving, like you are along the road, maybe somewhere away, a little bit away, and then the car is moving, you can be tracing the car with your eyes smoothly. Like the eyes have got that ability to trace the object of interest as it's moving. So that is called smooth. And in smooth pursuit, you have two scenarios. Scenario number one is the eyes are moving and the object is stationary, like when you are reading. So when you are reading, like the eyes are moving smoothly along the line, but the object is stationary. The line is stationary. Also, the other scenario in smooth pursuit is the object is moving and the eyes are stationary or are also tracing. For example, when the car is moving along the road, you can trace, like without moving the head, the eyes are tracing the car going along with it. In Swahili we say anasindikiza kwa macho, like the eyes are tracing, but the object is moving, so that is called smooth pursuit. That kind of smooth kind of movement that is tracing a moving or a stationary object is called smooth pursuit. But guess what? When we are reading, when we reached at this point, our eyes quickly jumped into the next line, and this is called a saccadic movement, and this happens automatically that you cannot even notice. And I'm sure as far you have came this far without knowing this, like you have studied the whole of the primary school, secondary school, high school, and now in university, but you've never thought about it. But this is what happens when you're reading. So when you're reading, you have combination of two movements. You have a smooth pursuit, which is tracing Yeah, the line, the eyes are moving smoothly to trace the line. And then when you reach at the end of the end of the line, your eyes are jumping quickly to the next line, so that you do not lose that you do not lose that what can I say, a bit or something. Like you read like naturally, as if nothing. So when you are reading, you are basically applying this neuroscience without knowing. Yeah. So you are tracing the line by smooth pursuit, and when you reach at the end of the line, you are jumping into the next line by saccadic movement or saccades. Yeah. Yes. So smooth pursuit, saccade, smooth pursuit, saccade, and this is beautiful, isn't it? Yes, beautiful. Okay, next we have Vergence system that we've already discussed. We have convergence and divergence, depending on you are looking at something which is close to you or away from you. Okay, we have another beautiful movement which is called vestibular eye movement. Listen, there is no best feeling in the world than understanding how your body works. Like, understanding how your body works is the best feeling that you have in this world. Yeah, and that's the beauty of anatomy, neuroanatomy, and neuroscience. It tells you how your body works, and it's so fascinating. Okay, back to the discussion. Vestibular eye movement is when your eyes are moving to compensate for the movement which is done by the head, so as to keep the object of interest focusing through the retina. Remember, why are eyes moving? The eyes are moving so as to keep the object of interest to the fovea centralis. So when your head is moving, trying to disturb the focus to the retina, the eyes are moving to the opposite direction so as to compensate for that movement that was made by the head. I want to emphasize using an example, and this is why I like, because you can practice here. Anatomy, neuroanatomy, neuroscience, you can practice what you're saying. Yeah? Okay, so I am looking directly forward at you. I'm looking at you guys. Yeah, and then my head is trying to disturb this movement, to disturb this fixation. Yeah, he's trying to look away from from you. Now the eyes have got that ability of moving in the opposite direction so as to compensate for the movement that is made by the head. For example, when I'm looking at you and the head is moving in this direction, you see I'm still looking at you. Yeah, because the head is moving in the direction, but the eyes have moved into the same degree, but in opposite direction. Like, it has moved for the same extent, but in opposite direction. That is called the vestibular eye movement. Yeah. Also, when I'm looking at you and then the head is trying to go down, the eyes are going a little bit up to compensate for the movement that is done by the head. But the key here is to keep the object of interest, focused to the fovea centralis. This is the hallmark of why your eyes are moving. Like, you should keep the object of interest to the fovea centralis to get the best quality of image from that object. Same applies when the head is moving up. Yeah, the eyes are moving downward so as to compensate. So they are moving downward to the same amount of degree, the same amount of movement, but in opposite direction. This is what is called the vestibular movement, and this is also controlled by you have some ear involved in something like that. Cranial nerve number 9, number 8. And is a system of its own. Of course, this is a little bit of neurophysiology, but it's also very important if you know it. And also, when you're trying to check if someone is brain dead, we usually test for this movement, and it is called the doll's eye movement. Doll's eye, you're going to figure it out in the discussion of the brainstem in the brain death. So that was vestibular ocular movement. It's called the vestibular ocular movement, or vestibular eye movement. It's controlled by the vestibular system, and the whole point is to keep the object of interest fixated. And then also have another movement which is called optokinetic system, and this system helps to hold images of seen word still on the retina during sustained head rotation. So you have sustained head rotations, but this movement are helping you to keep an object of interest, the right leg to fall to the fovea centralis. We have something which is called optokinetic drum. I didn't put a picture, but you can search in your Google, write optokinetic drum. It's a drum like this, has got different colors, and when it's rotating, your eyes are keeping on trace the movement. They are keeping on trace the pictures. You can try it. You can write optokinetic testing in the YouTube, and the my bad. I wouldn't. I couldn't put. I forgot to put the picture, of course. Optokinetic system. Yeah, but we also have something. Yeah, so this is smooth pursuit. You see, yeah, that the tracing like is a smooth pursuit movement, and this is kind of optokinetic movement. Yeah, movement. And then something which is called nystagmus. I hope you guys know we have horizontal nystagmus and vertical nystagmus, but this is a form of nystagmus. So nystagmus is a form of optokinetic movement. Optokinetic, like the back and forth, like oscillating. Your eyes are oscillating. Optokinetic. And then look at this boy here, is also having some form of nystagmus. Look at the eyes. This is called nystagmus. NYSTI, nystagmus. Okay guys, this is all I had for you today, and if you've enjoyed this discussion, don't forget to like and share with your friends. But if this is the first time you're seeing this channel, don't forget to subscribe, and welcome to the NeuroSketch community. Bye bye, see you next time.